White blood cell count. The white blood cell or leukocyte count is the number of white blood cells in 1 liter or 1 microliter of blood. Although most routine cell counting procedures in hematology laboratories are automated, it may be necessary to use manual methods when the counts exceed the linearity of an instrument. When an instrument is non-functional and there is no backup in remote laboratories. Principle: whole blood anticoagulated with ethylene diamine tetraacetic acid (EDTA) or blood from skin puncture is diluted with 1% buffered ammonium oxalate or weak acid solution, 3% acetic acid or 1% hydrochloric acid. The diluting fluid lyses the mononucleated red blood cell in the sample to prevent their interference with the count. The typical dilution of blood for the white blood cell count is 1/20. A hemocytometer is filled with the well-mixed dilution and placed under the microscope, and the number of cells in 4 large corner squares is counted. Procedure: clean the hemocytometer and cover slip with alcohol and dry thoroughly with a lint-free tissue. Place the cover slip on hemocytometer. Make a 1/20 dilution. Draw well-mixed venous blood exactly to the 0.5 mark in a white blood cell diluting pipette. This blood column must be free of air bubbles. Wipe the excess blood from the outside of the pipette to avoid transfer of cells to the diluting fluid. Take care not to touch the tip of the pipette with gauze. Immediately draw diluting fluid to the 11 mark while rotating the pipette between the thumb and the forefinger to mix the specimen and diluent. Hold the pipette upright to prevent the air bubbles in the bulb. Mix the contents of the pipette for 3 to 5 minutes to ensure even distribution of cells. Expel unmixed and relatively cell-free fluid from the capillary portion of the pipette, usually 4 drops. Place the forefinger over the top, short end of the pipette. Hold the pipette at 45-degree angle and touch the pipette tip to the junction of the cover glass and the counting chamber. 7. Allow the mixture to flow under the cover glass until the chamber is completely charged. Similarly, fill the opposite chamber of the hemocytometer. Note: if the mixture overflows into the mold or air bubbles occur, clean and dry the chambers, remix the contents of the pipette, and refill both chambers. After charging the hemocytometer, place it in a moist chamber for 5 minutes before counting the cells to give them time to settle. Care should be taken not to disturb the cover slip. While keeping the hemocytometer in a horizontal position, place it in a microscope stage. Lower the condenser of the microscope and focus by using the low power 10 times objective lens, 100 times total magnification. The cells should be distributed evenly in all of the squares. For a 1/20 dilution, count all of the cells in the 4 corner squares, starting with a square in the upper left-hand corner. Cells that touch the top and the left lines should be counted. Cells that touch the bottom and the right lines should be ignored. Repeat the count on the other side of the counting chamber. The difference between the total cells counted on each side should be less than 10%. A greater variation could indicate an uneven distribution, which requires that the procedure be repeated. Average the number of white blood cells counted on 2 sides. Calculate the white blood cell using the following equation.